tomorrow marks a year and a half since I've had the surgery. I think I mentioned that I had seen a pain doctor, or maybe I hadn't mentioned that in the last video, but I started seeing a pain doctor, seen him once. He wants to try injections since I have literally tried everything to help with this back pain, on top of the Addison's disease and the fibromyalgia. So he's getting that scheduled to make sure that my insurance will pay for it. So I'm kind of excited to share that with everybody. I can't remember exactly what the injections were called. Again, I might have put it on the last video that I had. I am not sure. But he did tell me that I should be running because life is too short and you can't let these things stop you. So kind of just take it slow, go at my own pace. So starting in January, so before that, we actually moved from our house. We bought a house and we moved. And that was insane. That was stressful. Anybody who has bought a house knows exactly what I'm talking about. So the packing and all of that stuff, we did everything on our own. I was down for a couple days. That took a lot out of me. My back was really bad. I was not trying to lift anything heavy. I mostly did the packing and unpacking and not the moving of the boxes. But we got in, we got settled. Tired of all this weight that I've put on. So I was like, you know what? I'm going to listen to the pain doctor. I'm going to start running and see how I do. Now, I wouldn't necessarily call it running. Being a runner before and being able to run a mile in, I think I was like at 7.5 minutes. It is taking me now about 10.5 minutes to run a mile, and I would call it more shuffling than running. My dog is great motivation. She is, every time I drop off my youngest son at school, and I come back, she knows it's time for us to go for a run. So that's really good motivation for me to go because she's super excited. So I've been doing that. My back tends to hurt, kind of in the first couple minutes, and then it's fine. And then, after, when everything settles down, I try to take a really hot shower, get some heat on it. But it hasn't been so bad that I couldn't walk it like in previous times. And I think that's because I'm not going as fast as I used to go. Like I said, I'm taking it slow. It is basically a shuffle. So doing that. So in February, I'm going to start adding in some different workouts along with the running, trying to get my body not necessarily back, because I know that's not going to happen. So just trying to feel better about myself, to drop some pounds. I am at like 162, so which I'm still in the normal range for everything. My BMI, body fat percentage, all of that, I'm still in the normal range for that, because I'm 5'10", and so, and I don't look fat. Like I'm not fat, and I'm not saying that, but I'm not what I used to be. So people understand that, and I know. So I've been on amitriptyline, and I'm at 100 milligrams right now. I'm still not noticing anything other than it's slightly less in the pain, not enough to really, I notice it, but it's not like a real noticeable difference. And then at the 100 milligram level, I have noticed that I tend, like in a couple hours later after I take it, I start to get just like a tiny bit drowsy. So I know that I'm on the path to being on the right dosage pretty soon, probably the next, if she bumps me up to 125, I think that would be good as far as like the drowsiness. Maybe that will help me get some sleep at night, but I've been sleeping really crappy, as always, having to watch what I eat. I really wanted to enjoy some cake the other day, and there's this place called Nothing Bundt Cake, and it is the best. If you've ever had it, oh my gosh, it's so good. So I was like, oh, a little piece won't hurt. It did. It set me into a huge flare. I was in a lot of pain. I probably got an hour of sleep that night. Had to end up sleeping on the couch because I didn't want to wake up my husband. It was awful. But as far as the back back stuff goes, I am, like I said, I'm looking forward to seeing what these injections will do. And from what I understand is the first injection that they do will kind of numb the nerves in that area. So if that works, I think he said even for a half an hour, they'll do the next injections, which actually deadens the nerve. And he says those can last up to 3 months or a year, depending on how fast your nerves regenerate. So knowing my body and having Addison's disease and fibro, my body is extremely slow to heal. So I'm hoping that it'll last longer. I'm hoping that it works so I can kind of get back into, not competitive running, but more competitive to myself running. I hate going that slow. I just really love running, and taking it this slow is killing me. But I also don't want to hurt or injure my back anymore. I noticed today though, there was like a ting pain right in the L5S1 joint area. It's almost like you could pinpoint exactly where it's at. So that kind of made me a little nervous. I'll mention that to the pain doctor, but yeah, a year and a half, and I'm really, I don't know exactly, like I said, in every video I say, I'm not upset that I got the surgery, but there's things that need to be, I guess, better. Like there should have been another option. Maybe I should have been sent to a pain doctor first to see what they said. The pain doctor had also mentioned that I shouldn't have had surgery, and had definitely not an ALIF. He said ALIF surgery for this kind of injury does not make any sense. And I told them the reason why was because they said it was like less of a possibility for something to go wrong, and he was like, that just doesn't sound right. So if you are getting an ALIF, I would actually kind of get maybe a second opinion or talk to your pain doctor, because like I said, mine said that it just didn't make sense to do. And maybe if I had it through the back, it would have taken. I wouldn't be in this pain, and it would have worked. So get that second opinion on an ALIF surgery. Definitely research, bring those questions to your surgeon. You know, they're supposed to be there to help you and to make everything easier, but you know, you really have to ask the questions and you know, seek the right answers, because every body is different, and just because it works for one person doesn't mean it's going to work for somebody else. So ask questions, do your research, talk to different doctors, and see what's going on. So I will keep you all updated on what is happening with the injections. When I get the injections, it would be really cool if they would let me record it while it's being done, but I think it shows your butt, so you can't put that on here, or I wouldn't want to. But so I will keep you guys all up to date on how those injections are going, if they work. So pray that they work.